Every nurse will ask themselves the same question. Did I make a mistake? What's up, everyone? Welcome back to the Daily Sean. For those of you who haven't been here before, my name is Sean. I do a daily video on something related to nursing. No rhyme or reason. Probably not going to change. Every nurse will ask themselves, Did I make a mistake? This is one of those self-reflecting questions when the going gets tough. When you feel like the room is closing in on you, when you feel like you're drowning. Every nurse asks this question to themselves multiple times during their career. I remember the first time I made that. I remember the first time I asked that question to myself. It was probably about halfway through nursing school. And I remember not doing very well on an exam and having another exam like the next day, and I had to study, and I had little to no sleep, and then I had this care plan that was like 20 feet long, and I had all these medications I had to look up because I had new patient assignments on clinicals, and it was just like I was literally drowning in my thoughts. And I remember vividly sitting at my desk, living at home with the parents at the ripe age of 30, sitting probably 2 in the morning, all the lights off except my desk lamp, and literally just staring at the desk going, did I make a mistake? What am I doing? Did I make a mistake? Was this the worst decision of my life? I'm here to tell you that I obviously survived. I went on to ask that question a lot more times. I remember asking that question to myself when I had my first job, and I changed jobs within 6 or 8 months because I was unhappy. I remember asking that question to myself when I decided to go do travel nursing. I remember asking that question to myself when I changed jobs from a job that was large hospital, long commute, to transferring to a hospital closer to home. I remember asking that question to myself when I decided to go back to school and get my bachelor's. And then again when I went back to school to get my master's. And then again when I took on my very first job as an NP. Are you catching on to the theme? Every big decision that you make that doesn't fit perfectly or doesn't follow a straight path is gonna freak you out. You're gonna freak out. It's okay. It's absolutely okay. In fact, it's almost normal, if not expected, to freak out. Because when you freak out, it's your mind's telling your body, your mind's telling your body that this is important to you, that this matters. So you're either going to turn left or right. You're either going to suck it up and put your head down, eyes forward, put your head down and go, or you're going to dial it back. You're going to kind of crawl away from the challenge and go, yeah, no, that wasn't for me. Yep, nope, moving on. And either decision is respectable, but if you're already in pain, then you might as well get something out of it. I don't know about you, but all the crap that I went through to get where I am today, to me, has been worth it. But I'm pretty sure that there's going to come a time, probably in the next year here, where I'm going to make some decisions about my professional life that are going to probably make me ask that question again. And I'll be ready for it, because it's going to be an important decision that I'm going to have to do a lot of self-reflection on. And keep in mind, you're not alone. You got a ton of people out there, here, on the internet, at work, family, friends. Talk to people. Get a sense of what is important to you. And if it's important to you, then no, you did not make a mistake. I'm here to tell you that asking that question is almost expected in our profession. When is the last time that you have had to ask yourself that question? Leave your comment down below. You know your comments are my caffeine. Share this with somebody. Share this with another nurse that you know could benefit from the knowledge that they are not alone when they ask that question to themselves. Share the vlog and pass it on! And as always, check your own pulse first.